Hi, I am Marta Muccio and I'm here today to talk about the book The Doctor's Plug, Germs, Childbed Fever and the Strange Story of Ignac Semmelweis by Sherwin B. Nuland, an American clinical professor of surgery at the Yale University School of Medicine. The book was published in 2004 and it describes the discovery by Semmelweis of the correlation between hand washing and the reduction of infections. With deaths from childbed fever exploding, Semmelweis discovered that the doctors themselves were spreading the disease. However, in the mid-9th century Vienna, this was a subversive idea. Not only, but the young doctor and diplomatic attitude did not help. In fact, even if these simple reforms work immediately, the book describes how they brought down upon Semmelweis the wrath of the medical community. His discovery may seem trivial, but later it would contribute to the subsequent affirmation of the theory of germs. The book opens with an historical account that plunges us into the serious problem of puerperal fever. On a sunny Sunday, a woman is on her way to Allgemein Krankenhaus Hospital in Vienna to give birth. After several tests performed by different doctors, the baby is born and the mother is fine. But 2 days later, she starts to feel an increasing discomfort in her lower abdomen, and there is a foul smell arising from between her legs. Before dying for almost 2 days, the girl lays in a sweat-drenched coma that alternates with brief periods of delirium. In that year, 1847, physicians and nurses were all too familiar with this type of disease, and the experience of Vienna was hardly unique. In fact, it was being duplicated in Austria throughout Europe and to a lesser extent in America. Across the 18th and 19th century, there were also sporadic outbreaks of childbed fever in the practice of individual midwives and obstetricians. But the reasons for the marked difference between inpatient and outpatient population were not clear to the physician of the time, that didn't have the knowledge of the role of the bacteria in disease, until more skilled dissectors arrived up to the point of postulating that some agent was being transmitted by the same physicians to their patients. Using method taught by his great master Rokitansky, professor of pathological anatomy at the University of Vienna, that our main character, Ignac Semmelweis, did in fact find the correct answer to the problem. Semmelweis was an Hungarian doctor who joined the obstetric department of the Vienna hospital Allgemeinen Krankenhaus, a teaching clinic where medical students had the obligation to perform up to 15-16 autopsies a day and then directly proceed to the internal visit of the parturients. When Semmelweis took his service, however, the situation was not the best, because of a childbed fever's outbreak. At that time, there were two different divisions in the Allgemeines Krankenhaus, and Semmelweis was able to notice that in the second one, where the doctors did not practice, but the new mothers were assisted only by nurses and wet nurses, the mortality rate was significantly lower. Up to him, this happened because of the difference in assisting births. Nurses, unlike doctors and medical students, did not take part to the dissection of dead bodies, later which the doctors themselves did not wash their hands, promoting the transfer of germs. Not convinced, he carried out an experiment. All doctors had to wash their hands with calcium hypochlorite before moving from one department to another. And after the trial period, the number of deaths from puerperal fever dropped dramatically, bringing the statistic of the two clinic pavilions closer together. And it was at this point that Semmelweis had the confirmation of the correlation between poor hygiene and contagion. Unfortunately, the precautions taken were lost little by little. And even if you could count on the support of some friends such as Skoda, Embra, Rokitansky, it was not enough to spread the new theories. Strongly opposed by the medical community, indignant by his suggestion that doctors themselves could be infectors. Anyway, the proof of the real correlation between disease and germ will arrive in the mid-18th centuries, thanks to the work of Louis Pasteur. I would like to finish this video as the book ends because in my opinion it's a perfect summary of what Semmelweis' life has been. This is precisely how Sophocles might have written it. A great hero, a great truth, a great mission, and finally a mad flight of passionate arrogance resulting in destruction. The gods who were the professor of obstetrics did not bring it about. The hero brought it on himself.